I'm Dr. Michelle Nace. We've had a lot of questions about what PPE is, and that stands for Personal Protective Equipment. And I'm going to do a little demonstration and show you a little bit to give you a visual about what our healthcare workers are using in the hospital. So first off, it would be talking about the difference between the way in which viruses can be transmitted. And I'm going to talk about two ways. One way is airborne or through the air, and one way would be droplet. So an airborne virus or germ could be kind of suspended in the air. So if you think about it, we think about measles, which is highly contagious through the air. If someone with measles coughed and it was here in the air and left, and then I walked through that, I could contain the virus because it's airborne. I could breathe it in and I could be infected that way. Droplet-wise, viruses that transmit by droplet could be, if I coughed in my hand, went for a doorknob, touched the doorknob, then somebody else touched that doorknob and then touched their face, they could transmit it through that way. So different viruses and germs can be transmitted different ways. Now, the confusion that's had with coronavirus is that there's not a certain way, and it's not a certain explanation that's known that we know 100% how it goes. We know that it's in droplets, and we also know that it can be temporarily in the air, but it doesn't stay up in the air like what measles does. So because we know that it's in droplets and it can be in the air for a certain amount of time, we want to protect our patients and our healthcare workers to the best of our ability. So there's two types of masks that you might be hearing about. One would be a regular and what we call a surgical mask, and that's a mask like this that helps. And when I put this mask on, and I hook it on there, what you can see is that air can still get through there. I'm protected if someone coughs right in my face from the front part, but if there's air, if it's airborne, it can get in through the sides. So this does help, but it doesn't make it positive so that air can't get through there. Now, the different mask you also heard about is what's called an N95. This is that mask. An N95 mask has a different filtration system and it's fitted. So our healthcare workers are fitted for these to make sure that they fit the form of their face in a better way than a generic surgical mask. So when you put this mask on, what you're going to see different is it's molded to my face. It covers my face and goes around. If this size didn't work, we'd get a bigger size. So that's the N95. It goes right on your face and it better protects for airborne transmission. So when you first walk into a hospital setting or in the 10-level clinic or first care, you're gonna see screeners. Our screeners are all wearing a mask like this and an additional coverage, which are goggles like this. They're here, and they're covering their face. So these are the masks that they're using when you first walk into the room. If you're determined to be at higher risk and we have a patient once you get into the hospital and we're concerned about COVID, then there's a different set of PPE that you would be wearing. So what they would have, if I was walking into a room and with a patient that there was a high suspicion for COVID or had it, then I'm gonna have on a different set of PPE. And then depending on what I'm doing with that patient would also be a different set of PPE. So if I'm the clinical care worker who's taking care of a COVID or COVID concern, here's what I'm gonna be putting on. I'm putting on first a gown. So I have a gown, and if I'm walking in there, the next thing I will have on is my mask. Notice it's not an N95 mask, it's a mask, a surgical mask. And then I'm putting on also goggles to protect my eyes here. And then in addition, I'm wearing a pair of gloves. So I'm gonna put on. This is if I'm going in there to take care of the patient. If on the other hand, I'm a provider who's doing an additional intervention, such as doing the actual test or giving a nebulizer treatment or something that's going to be aerosolized, I want to make sure that healthcare provider has even a stronger mask, and that would be the N95 mask, and they would be wearing that. So there are also additional things you can, instead of goggles, you might see someone wearing a face mask. That's this. Still protects your eyes. And in addition, you'd have your mask on underneath, like so. And so you have that protection. So there's a lot of different ways in which we can protect our healthcare workers. And so there's a balance that we're trying to do. We're trying to balance between conserving our PPE and being good stewards of how we use that equipment, but also maintaining the safety of our patients and our healthcare workers.